today's visit, we kind of did what I would call kind of a positive stimulation or socialization type of visit. So I played songs that I knew that the patient probably heard, and we just kind of sing those, and I kind of see if the patient's tapping his toes along or sometimes maybe mouthing the words.
It inspires him. It's not the quantity of life, it's the quality, and she makes it better.
I think the best way to describe complementary services, they're the thing that makes us unique as a hospice. So traditional medicine involves doctors, nurses, and the things we're very familiar with. Our complementary services complement that, hence the name. So we have these specialized individuals in horticulture, music, massage, Reiki, pet therapy. It's a much longer list than that. And they go out and they do specific things with patients, whether it's, again, for pain control, comfort, reminiscence, life review, legacy projects. They do all of those things just to enhance quality of life in a non-pharmacological way.
Okay, take a deep breath. Relax.
When he leaves, I feel so much easier and so much more comfortable. I always say, that's good.
There's just something about pain being reduced just when you lay your hand on somebody. It's so natural. It goes a long way when somebody's in awful pain to be able to put the hands on and work, and bring that touch and that comfort.
Nature helps people to focus. It's calming. It helps to bring down blood pressure levels. And what I do is I take nature into the patients who can't come out to the garden. I was taking herbs to a gentleman who was unresponsive, and his grown daughter and his wife were standing by the bedside. And his daughter told me that he loved cooking and he loved oregano, and I handed her the herb vase, was walking away, and heard her saying, Dad, you gotta smell this. This lady brought you some herbs. It's oregano, Dad. His last breath was smelling something that he enjoyed and he loved.
We show that more than 95% of the visits they make result in some sort of improved item. So that could be reduced anxiety, less rapid breathing, less rapid heart rate, increased communication, lessened pain, and we can use a pain scale. So it's pretty impressive that 95% of the visits are showing an improvement in something that is important to that patient. Our goals for this year and going forward are to expand those programs so that more patients can have more visits. You can only do so much with so many people, and we'd like to add a bedside expressive arts program. It's not about becoming an artist like Rembrandt or Picasso, it's about them exhibiting choice, creating something that's a legacy, having something interactive, and on the most basic level, it might be the only choice they're given that day. These things are non-billable, so they are the things we choose to do because it's right for our patients, and it's the things that they deserve. It's the things that make their days brighter. We do rely on donor support to make sure that these services continue and that we can grow the program.
I love the work that I do, and I go home most days uplifted. The only downside is when you have to turn people away from service. I guess that's the hardest part, when you know somebody could benefit, but you just don't have the resources.
It's most important. It's so very important. I couldn't exist without Tidewell, because with Tidewell, I'm beginning to stay alive again. I might as well say I'm 106. How much longer am I going to be? If I'm going to die, I might as well die healthy. If one can do that.